This is One on One. We're pleased to welcome Matt Weissert, who is Senior Vice President of Operations at Paladina Health. Good to see you, Matt.
Thanks, Steve. Thanks for having me.
What is Paladina Health?
Yeah, Paladina Health is direct primary care, but I'll make it simple. You're a family doctor. So we have, it's family physicians, but we do it a little bit differently. So we have a membership fee that takes care of all the costs involved. So a normal physician's office will do a fee for service, or they'll, every time you come in, they're going to charge you a copay, and,
Right.
and then you're going to get billed after for anything that's
You
done.
guys don't do that?
We don't do that.
How does that work, the economic model?
Yeah, so the way we do it is we go direct to an employer, in this case the state of New Jersey, and they're giving us a membership fee for each one of their employees that choose to join. And then when they do that, they have 24/7 access to their physician. They have same day, next day appointments. We have no wait time to get in, and then they have a minimum of 30-minute appointments with their physician. And then from there, there's no cost. So they have no copay. And then everything we do inside those four walls, or when they call, we don't charge. We don't bill for it because the membership fee takes care of it.
Someone says, hey, come on, that sounds too good to be true. You say?
I say, that's what I usually get. People say that, like, what's the catch? And
yeah, what is the catch?
There really is no catch. So our physicians are, they're employed by us, and they have about a third less of the patients that they would normally have in a family physician practice today, in a normal system. So for them, they're able to spend more time with the patients, spend more time with the families, and make sure they're providing great quality health care. That's all their job.
I'm curious about this. How do you recruit the docs that you have? Because if someone says, well, if I see more patients, I'm making more money.
Sure.
You're saying it's about a third less patients, fewer patients.
Yeah, so our physicians on average usually have been practicing for 7 to 10 years. They've been out in the system. They went to medical school to learn how to take care of patients, to spend time with their patients. They get into the system, no fault of their own, and they start seeing, like, I've got to see 30 patients a day. I've got to see somebody, I can only spend 5-10 minutes with them. And they just get into that grind. Where with us, we say, hey, come back, take care of your patients, spend time with them. You get to choose how much time you spend with them and what you do. Build the relationship with them. So you have those physicians that are out there, I want to get back to practicing, what I went to school for. I want to have that relationship with my patients. And so that's how we bring them over.
So this is not an effort to politicize at all, but it's an effort to try to understand. As we do this program moving into the holidays of 2017, we don't really know exactly what's going to happen with the Affordable Care Act, right, in Washington. How much does the ACA and what happens to it impact the ability of Paladina to do what it does?
Yeah, personally for us right now, unless some legislation changes in it, it wouldn't affect us at all. Simply because we don't bill the government, we don't bill insurance companies, so we're getting our direct fee from the employer or from the state in this case. So for us, it doesn't change anything on how we'll do it going forward. It's really all about taking care of the patients.
So how much of it has to do with educating patients about this whole experience? Because it is different.
It is.
From some other experience they would have.
Yeah, so you said it before, what's the catch, right? What's in there? And it is. So we have to get out there and tell people, just like any other change, this is an innovative way to look at healthcare. You've only known one system, which is when I go in, I have to pay my copay, fee for service, and the more volume you have, that's how they make them. That's how the money is made. Where in our case, it's no, just come in. You don't have a copay. There's no barrier to get in. You have same day, next day appointment. You can get in. We call it small waiting rooms with nobody in there because we're going to get you in right when your appointment is. Come back to that and really be a part of it.
And trying to do the math on this. If someone is in there longer, because he or she has some real issues, and the physician is the primary care doc is taking a lot of time with him or her, how do you account? I mean, I don't want to get into the weeds here, but how do you account for that so that you walk in the waiting room and there's not a long wait, but people are spending more time with patients? I'm wondering how that adds up.
I think the biggest thing for us is when you set up an appointment, we're guaranteeing a 30-minute appointment. So right away, we've already blocked off that amount of time. But what we tell our staff to do and our care teams to do is when you're calling, do you think this is something where you're going to need more than 30 minutes? And usually people can gauge how that is. Oftentimes when we have our first appointment, we'll set aside 60 minutes because we're going to do a physical or a history to find out what it is about that patient. So just like with anything else, there can be times where people go over or under, but in general, our wait times are 3 to 5 minutes.
The whole primary care thing is fascinating to me because I have this terrible habit. If I think something's going on, and I'll try to reach out for a particular specialist, you know, because he or she, that's what they do. But the reality is, your argument, and the argument of many, is that the vast majority of medical issues can and should be dealt with by a primary care doc.
I would agree. So, and it's not just me saying that, not just Paladina Health saying that. It's across the board. About 80 to 90% of all
80 to 90%?
80-90% of all healthcare needs can usually be taken care of by a direct primary care physician. The issue is they usually don't have enough time. And what we've tried to do is take that back.
Yeah.
So give them the time to be able to sit down with the patient and talk to them and really come up with a plan.
Who thought of this?
I think we were talking about it earlier. I wish I could say.
I'm serious.
Yeah.
Okay, who sat around and said, hey, we're going to come up with a new model?
Yeah, there's been organizations that have been doing this for years. You know, and the direct primary care is the official term.
Direct primary care.
Direct primary care, and that's just the term for it. But I think again, it's your family physician. You know, not to get too complicated about it. We came up with it at Paladina Health about 5 years ago, just saying how could we help change healthcare? How could we do it for the better? And we had 3 guiding principles, which were we want to have great quality healthcare. The second thing was we want to make it, you know, great customer service, have it be a great experience for people. And then third, save money not only for the member or the patient coming in, but also for the healthcare system. Because if you do the first two, but you don't save money, it doesn't help the healthcare system or people.
Final question, Matt. You're in 10 states?
We're in 10 states right now.
Why New Jersey? And by the way, where in New Jersey?
So we're in Clifton and Hamilton, just outside Trenton.
So in northern, actually Clifton only a few miles away from where we're taping right now at TriStar, a great production operation. And then down in Hamilton.
Yeah.
Why'd you pick Jersey?
So it's interesting. So of all the things, the state and the unions got together and they decided.
Hold on, the state and the unions got together in and of itself. Never mind.
Yeah.
Go ahead.
So no, but I mean it's a great. New Jersey right now is really leading the way on innovation in healthcare, and so they actually got together and they said we're going to write a resolution, which they did. They then did a national search, and we were one of 2 providers that was chosen because of that. And we're excited to be here in New Jersey. We have 2 offices now, but Paladina Health hopes to be in many, many locations moving forward.
It's interesting to me, before I let you out of here.
Yeah.
You do not have a New Jersey accent.
No, I do not. What? I'm sorry?
Indiana.
I'm from Indiana.
I just guessed that. No, you told me before. And immediately, of course, I had to ask you about Hoosiers.
Absolutely.
Which everyone does.
Yeah.
Listen, I just want to thank you for coming in. I want to just one more time thank Matthew Weissert, who is Senior Vice President of Operations at Paladina Health. And I appreciate you coming in and keep us posted on what's happening.
Thank you, Steve. Really appreciate it.
Thanks so much.
Thank you.
Good stuff.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, Montclair State University, New Jersey Resources, MD Advantage Insurance Company of New Jersey, New Jersey Sharing Network, the law firm of Gibbons, P.C., and by New Jersey State Nurses Association and the Institute for Nursing. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.